I'm Tunde Peto, Professor of Clinical Ophthalmology at Queen's University Belfast and the Diabetic Eye Screening Program lead in Northern Ireland. Some people, about 1 in 10 in any screening programs, develop what we call maculopathy. The macula is the center part of the eye, and maculopathy is characterized by leakage, i.e., the vessels start pushing out a little bit of fluid or blood or exudates. Most people, even if they have a little bit of leakage, they don't need treatment. And most of the times, these can go on for years without treatment. So it's important to attend, but it's important to know that you might just need to be monitored. The next stage is that you might need treatment. If that's the case, please go, because in order to keep your eye health and good vision, it's extremely important that those additional tests are done. If you have maculopathy and requires treatment, then a lot of the times we can put a little bit of laser on there to make sure that a little bit of fluid goes away. However, if maculopathy has reached the center of the eye, then we need to think differently because we cannot laser the very center of the eye. Now we have drugs that we can inject into the eye to make sure that the fluid goes away. And these treatments are done under local anesthetic. So we put lots and lots of numbing drops to freeze the eye. And it's the tiniest needle ever that goes into the eye and delivers the drug. The new drugs that we have now, a lot of them are much longer acting than the ones before. Most people will have what we call the loading dose, so get the drug very frequently, every 4 to 6 weeks to start off with, 3 or 4 times. And then a lot of people will be going to 8 to 16 weekly intervals. Sometimes we need to do both the laser treatment and the injections to calm the diabetes-related eye disease down. And in those cases, you will be our guest at the eye clinic very many times to start off with. But with proper treatment, after about a year, most people's visits become much less frequent. For the vast majority of people, treatment with laser and or injections will be enough to make sure that vision is maintained and as good eye health is maintained as possible.